So it must be a very confusing message that you hear from all of us, stay home. But that was actually in the beginning of this pandemic when we didn't know what to expect. And so now we want to balance. We don't want to be sitting on patients at home who really need emergency care. But because they actually listened to our initial message of staying home, now they're not really seeking, care.
We've seen an increase in at-home cardiac arrests because patients who are having chest pain or shortness of breath and are afraid to come to the emergency department are staying at home, and they're dying at home because they're actually having a cardiac event or they're having a major respiratory event unrelated to COVID. So please, if you're having any of these symptoms, seek medical care.
The reality is some things don't get better on their own, and you need to intervene, and sometimes we can stop the progression of a disease that could be easily managed if managed early.
So the challenge is we want to provide the best care possible to our patients while we're taking all the precautions to prevent exposure to COVID-19. So with that being said, every single person in the emergency department is wearing a mask, and that goes from the person who is registering the patient to the triage nurse, to the treating physician, to the environmental services who are taking care of our environment and keeping it clean in the emergency department. Everyone is taking precautions.
That's why we're here. We're here for you. And it's so sad to see someone come into the emergency department or into the hospital who we know that they've delayed for purposes that they were trying to do the right thing.
There's many case scenarios where there's actually more complications from sitting home on these type of illnesses versus seeking care, or, knowing that every single person in the emergency department goal is to provide the best care, but also minimize the risk of exposure to the virus.